and welcome into Your Health. October has been Breast Cancer Awareness Month, and basically it happens to women. It can also happen to men. One of my great buddies wound up one day with breast cancer. So we run in today an expert, Dr. Kertrisa McWhite, and we're glad to have you back again. You've been with us before.
Thanks for having me again.
And basically, you're a surgeon.
Correct.
And your primary area is breast cancer?
Right. I specialize in the treatment of breast cancer only. I do also see patients who have benign conditions of the breast. I encounter many individuals who have either felt a palpable lump in the breast, they've developed some skin changes or nipple discharge. They need to be worked up to determine if their problem is a cancer or not.
Okay, the big thing, the mammogram.
That's right.
Okay,
that's the biggie.
That's the thing. Every woman that I know says, "Oh, got to have a mammogram."
Oh, there's nothing to it.
Okay,
that's right. There's nothing to it.
I've never been down that road, so I don't know. So,
but if you're going to get your yearly flu shot, if you're going to go in for your colonoscopy or your Pap smear, for heaven's sake, go get a mammogram. All right.
May I ask you? Now, it used to be that we did that every year. What are the guidelines now for women?
The guidelines have shifted a bit, but at its core, women who are at average risk should be getting a yearly mammogram starting somewhere around 40 to 45 years of age. There is certainly controversy about whether women over 65 or 70 still need to get a mammogram every year. I will tell you, I still encourage all of my patients to continue yearly.
I agree.
You just never know. You just never know. And physical exam is not foolproof. Imaging is not even foolproof. It's when you add all of the studies that we can do, all of the screening techniques that we can employ, when we can really catch cancers at their earliest stage and hopefully cure them. Many, many breast cancers are curable at the time of diagnosis, and that's all down to early detection.
It's almost like prostate cancer in men.
That's right.
The earlier you get it, the better off.
So what are some of the other techniques other than a mammogram that we all need to be doing?
Okay, so for a younger patient or for men, for example, we might start with a breast ultrasound. That's a completely painless study. It only takes 10 or 15 minutes, and it tells us a lot about what's going on in the breast. A breast MRI is often used as well, especially for women who have a dense breast or who are at higher risk for breast cancer, perhaps because of a family history or genetic mutation in the family. So there are many things that we can do that are, again, painless.
Yeah, I agree, and I just, mammograms are they're very easy. You schedule them, they're quick, it doesn't take long, you're in and out, and it's read right there.
That's right, that's right.
So, you know, if I've got something, I would rather know.
And I really want your viewers to know this. If you're out there and you have no insurance or you don't have good coverage, there are programs available that will help you obtain a mammogram.
Joy to Life.
An ultrasound, for example, that's right, Joy to Life.
Is one,
And the state has a program. Ask about the ABC program at your local health department.
ABC?
ABC. That program, that's right, can get you in to see a specialist just like me and get the imaging that's needed.
Okay, with the state health department.
That's right.
I was not aware of that. Thank you so much, because we do have some listeners that probably for one reason or another would need some help, and you're the very ones that is set up to help you. Because what I love is now, if you are diagnosed with breast cancer, that used to just be, you used to think it's all over.
Right. People think the absolute worst.
Not so.
Yes.
I can't tell you how often I'm able to give my patients, even within the setting of maybe not so good news about the type of cancer they've been diagnosed. It may be hormone sensitive. We may be able to offer them pills to take instead of strong chemotherapy. They may be able to avoid radiation therapy. They may be able to have a lumpectomy, just taking a little breast tissue away rather than having the entire breast removed. Just don't wait, don't sit on it.
Well, we're going to have you back, and one of the things that Jack and I were talking about, we're going to talk about not only the surgery, but things that we can do to stay healthy to try to prevent that from happening.
Absolutely.
And do our audience, do we need a referral to come and see you?
It depends on your insurance plan. However, if you give the UAB Multi-Specialty Clinic a call, it's UAB Breast Health Clinic at 747-8850. My staff will be happy to help you and direct you.
Great.
Right here in Montgomery, Alabama.
Right
We're
here.
local, thank God.
That's right.
Well, thank you so much for being with us, and we'll be right back.
Thanks, guys.